Comprehensive Assessment of Cognition, Domain in CHC Assessment. Do they experience frequent difficulties with short-term memory, such as forgetting conversations, misplacing objects, or repeating themselves within a short time? Do they have impairments in long-term memory, struggling to recall past events, personal history, or recognize familiar people and places? Do they frequently become confused about time, date, location, or their own identity? Do they recognize familiar carers, family members, or friends, or do they show signs of distress or confusion when interacting with them? Can they navigate familiar surroundings independently, or do they require guidance to prevent becoming lost or disoriented? Have they recently shown a decline in cognitive abilities, and if so, what changes have been observed? Have they undergone any formal cognitive assessments, such as the Mini Mental State Examination, MMSE, or Frontal Lobe Test, FLT, and what were the results? Do they have a diagnosis of dementia, Alzheimer's disease, or any other cognitive impairment that affects their daily functioning? Does their ability to make decisions fluctuate, or is their cognitive impairment consistent? Can they make simple decisions such as choosing what to eat or what to wear without significant difficulty? Do they have the capacity to make complex decisions regarding their health care, finances, or living arrangements, or do they rely on others for such decisions? Do they need support or guidance from carers when making decisions about their daily care, routine, or social interactions? Are they unable to make even simple decisions due to cognitive decline, requiring full assistance from carers? Do they understand and assess basic risks in their environment, such as crossing the road safely, handling sharp objects, or avoiding trip hazards? Are they fully reliant on caregivers to ensure their safety due to their inability to recognize or manage risks? Do they require supervision at all times to prevent them from engaging in unsafe behaviors such as wandering, leaving doors unlocked, or using appliances unsafely? Have they exhibited behaviors that suggest impaired judgment, such as inappropriate financial decisions, paranoia, or impulsivity? Do they struggle to process new information, learn new routines, or adapt to changes in their environment? Do they require frequent reminders or structured support to complete daily tasks such as eating, dressing, or personal hygiene? Have they been observed struggling to follow instructions or forgetting tasks that were explained moments before? Do they show signs of distress, agitation, or confusion when placed in unfamiliar settings or when their routine is disrupted? Have they required any specialist interventions or assessments related to cognitive impairment in the last 6 months? Are they prescribed medication to support cognitive function, such as donepezil, rivastigmine, or memantine? Are they under the care of a specialist, such as a geriatrician, neurologist, or psychiatrist for cognitive impairment? Have they demonstrated behavioral changes associated with cognitive decline, such as aggression, restlessness, paranoia, or withdrawal from social interactions? Have there been any incidents where their cognitive impairment has led to safety concerns, such as wandering, leaving appliances on, or failing to eat or drink? Has cognitive decline impacted their ability to communicate their needs effectively, resulting in frustration or misinterpretation by carers? Do they require close supervision to ensure they complete essential daily activities such as eating, dressing, and using the toilet? Has there been a noticeable decline in their ability to maintain personal hygiene or complete self-care tasks due to cognitive impairment? Have risk assessments been conducted to evaluate the impact of cognitive impairment on their safety, well-being, and ability to manage daily tasks? Have formal cognitive evaluations been carried out, and what were the findings regarding their level of impairment and care needs? Are there concerns that their mental capacity fluctuates, with some days where they appear more aware and capable than others? Do they require assistive devices such as memory aids, calendars, or visual cues to support cognitive functioning? Are their carers trained in dementia-friendly communication techniques and behavior management strategies? are structured interventions, such as cognitive therapy, reminiscence activities, or sensory stimulation being used to help manage cognitive symptoms? Have there been any recent changes in medication or care plans due to deterioration in cognitive function? Are additional specialist assessments or referrals needed to determine the best course of action for their cognitive care and support? Have they demonstrated difficulty in recognizing personal belongings, forgetting their location, or becoming easily confused in familiar settings? Have they experienced increased anxiety, distress, or agitation due to their cognitive impairment, and how is this managed? Have they shown signs of apathy or lack of motivation, resulting in decreased participation in daily activities or social interactions? Are they able to recall significant personal information such as their name, date of birth, or the names of family members? Do they demonstrate a decline in problem-solving skills, struggling with tasks that require logical thinking or sequential steps? Have carers reported challenges in engaging them in meaningful conversations due to repetitive speech, difficulty finding words, or losing their train of thought? Have they exhibited compulsive or repetitive behaviors, such as pacing, hand-wringing, or repeating certain phrases or actions? Do they require structured daily routines to help manage their cognitive symptoms, and how do they react to deviations from their schedule? Have they received psychological support, such as therapy or counseling, to help manage the emotional impact of cognitive decline? Are there concerns about the impact of cognitive impairment on their ability to engage with and benefit from social activities? Please share your thoughts in the comment section below.